PS Ambassador Kabiria. Let me start from the last one on home-based deaths or community deaths. Out of the 10 mortalities you have reported today is only one that is a community or home-based death. And let me restate again that we are usually very concerned about home-based deaths because usually people who die at home means they're most likely symptomatic and they are shedding the virus in huge quantities. And in the spirit of Africans, as we care for the sick, then that puts the immediate members of the household at risk of transmission of disease. I want to report here gladly that the home deaths that we initially reported from Mombasa have since ceased. I want to thank Mombasa County through the leadership of Excellency Governor Joho and his team for a job well done. We'll still be on the lookout for home-based deaths wherever they occur so that we can be able to offer support to ensure that we change our health-seeking behavior so that people can be able to seek health services in health facilities. Let me also further add something about the Dadaab and other refugee camps. Of course, these were areas that we picked as potential hotspots because you know our refugee camps are domiciled mostly in the eastern part of the country, and we have a porous border with our neighbor Somali. And because of the nature of the movement there, this area was picked as a potential hotspot. And the cases that we have received from there testify to that effect. What we have done, of course, to ensure that we have capacity building, we ensure that we have enough protective gear. We have supported Garissa County with enough protective gear, capacity building, and of course, the issues of infection prevention and control. Further, working through a multi-agency team, that is the security apparatus, Department of Immigration, the public health officials, and the Nyumba Kumi initiative to ensure that anybody who moves in can quickly be identified and quarantined appropriately. Regarding asymptomatic and pre-symptomatic, very good scientific approach. Asymptomatic means you are tested positive for COVID-19, but throughout the span of the disease, you don't develop any symptoms. While pre-symptomatic simply means that you test positive for COVID-19, but over the period of the disease, then you develop the symptoms. Yesterday, I clearly articulated to you people here that 88% of our people are asymptomatic. They don't develop any symptoms throughout the span of the disease. So it's only the 12% who either have symptoms or who are pre-symptomatic. Initially, they don't have symptoms, but over the course of the disease, they develop one symptom or the other, like fever, difficulty in breathing, cough, loss of taste, or loss of sense of smell. It is with this view in mind that based on the WHO guidelines on home-based care, we further refined our home-based care through the support of our case management team. And this criteria is a very strict criteria that requires, one, that you must have a positive COVID-19 test. Number two, you must be asymptomatic. So the moment you have any symptom, then you don't qualify for home-based care. Or if you are in home-based care and you develop any symptom during the period you are in home-based care, then automatically we transfer you to an isolation or a treatment center. This is to be able to safeguard the members of the household and the community at large. And we are now uploading the module on home-based care for the community health volunteers and other healthcare workers to ensure that we sensitize the more than 60,000 community health volunteers and more than 30,000 healthcare workers to ensure that these instructions and guidelines and protocols are followed to the letter, not only to be able to relieve the burden of our healthcare system being overwhelmed, but also to bring services closer to the people. And as we stated previously, we have done this successfully before with other conditions, including HIV/AIDS. So we will not leave anything to chance. We'll apply a very strict criteria. We'll have a serious monitoring tool and we'll have to get reports every week to ensure that the guidelines and protocols work as proposed. Thank you.